So if you have been told you have fatty liver or non-alcoholic fatty liver disease, the good news is that it is fully reversible. And in this video, I will go over the exact steps you need to take to not only reverse it, but to do so quickly and start seeing the changes in weeks. I will also discuss the foods you need to eat and the foods you need to stay away from to fix your liver. And at the end of the video, I will tell you if you need any supplements to help your liver recover and go back to normal. I'm Dr. Sethi, a gastroenterologist and a hepatologist, helping you optimize your gut and liver health. So let's get right into it. Now, to better understand how to reverse fatty liver, we first have to identify what causes it in the first place. And it is pretty simple. Fatty liver is caused by, for the most part, overconsumption of sugars, and specifically fructose and sucrose. Sucrose is table sugar that breaks down into fructose and glucose. The consumption of both fructose and sugar sets off a whole cascade of changes in our bodies that leads to not only fatty liver, but also other conditions like diabetes, heart disease, dementia, and even cancers. Now, what makes fructose unique is that it does not stimulate leptin. And leptin is a hormone that is released in our bodies after a meal that signals satiety or fullness to our brains. So consuming fructose does not generate a normal response in our brain that tells us that we are full. So that makes it very easy to overeat. And if that wasn't bad enough, continued consumption of fructose drives the development of leptin resistance, which results in persistent hunger and impaired satiety, even with other foods and not just fructose. In fact, a study published in the American Journal of Clinical Nutrition found that just 7 days of high fructose diet increased lipid deposition in the liver and decreased liver insulin sensitivity. Now, how do we avoid fructose? Well, fructose is a simple sugar that is usually found in honey, fruits, and root veggies. And humans have been consuming these for hundreds of thousands of years, and it did not pose a health risk until we started eating manufactured fructose and sugar in large quantities. Now, most fruits and veggies contain fructose. However, our intestines can inactivate about 45 grams of fructose, which is the amount we usually get from veggies. We get a little bit more fructose from the fruits. However, fruits, like veggies, are also consumed with a lot of fiber, which slows down the absorption of the excess fructose. In addition to that, many fruits are also rich in vitamin C, which blocks some of the effects of fructose and negates any of the adverse effects of fructose that we get from fruit. So that brings us to the first food group that we need to avoid to reverse your fatty liver, and that is sugary drinks. Now, we all know about the dangers of sodas and soft drinks, but the sneaky drinks that contain a lot of sugars are juices, which are often promoted as healthy and frequently given to kids. If you drink orange juice, apple juice, tomato, cranberry, or any type of juice bought from the store, please look at the ingredient label and see how many grams of sugar you get just from one serving. Do not be fooled by statements like it contains natural sugars or it has 0 grams of added sugars. It may be natural, but it is still highly concentrated and it is consumed without the fiber you would normally get if you were eating a whole fruit. And it is a lot easier to overconsume sugars if you're getting it in a liquid form as compared to eating a raw fruit. Other drinks that are notorious for just being loaded with sugars are sports drinks and energy drinks. Now, the American Heart Association recommends eating less than 24 to 34 grams of sugar per day. But if you suffer from fatty liver, I would abstain from all drinks that contain sugars. Along the same lines, I would also avoid eating fruits like date or raisins or prunes. Yes, they are natural and do not contain added sugars, but those natural sugars are very concentrated in these dry fruits and do not have the volume of the original fruit, which makes it much easier to overwhelm our GI tract and later our liver with fructose and sugars. A study published in JAMA in 2019 noted that just 8 weeks of restricting sugars in adolescent boys to less than 3% of their daily calories showed significant improvement in hepatic and hepatic steatosis. Another way to fix your fatty liver is to eat more protein. And it is especially important to eat more protein for breakfast. A recent study published in the journal Obesity looked at over 9,000 Australians and found that getting enough protein, especially for the first meal of the day, had profound effects on what people ate later in the day. And eating higher levels of protein for breakfast or the first meal of the day translated consuming less food over the course of the rest of the day. But people that had a low protein breakfast were found to eat more energy dense processed foods and foods that were high in sugars. So if you find yourself constantly craving for those sugary or processed foods, foods that will make your liver fatty, try to increase your protein intake, especially for the breakfast, and aim to get at least 25 to 35 grams of protein per meal. If you're getting 3 meals a day, getting enough protein will help you eat less sugar and lose weight. And weight loss has been shown to be one of the most effective ways to reduce fat in the liver. In fact, just 5% of the total body weight loss can decrease fatty liver, and losing 7% of total body weight can lead to complete resolution of non-alcoholic steatohepatitis or NASH, which is a more severe form of fatty liver. Now, as you increase your protein intake, you have to be careful about what kind of fats you're getting in the process. Animal meats and dairy products are wonderful sources of protein. However, we do have to watch our intake of saturated fats, and those are usually found in red meat, processed meats, butter, ice cream, as well as many fried foods. Now, eating red meat is a controversial topic, and I personally believe that it is okay to consume red meat in moderation. So it is important to not overeat saturated fats. And I emphasize not overeating, as it is okay to eat saturated fats, but in moderation. So what that would look like is eating less fats that come from processed meats, or eating less store or restaurant brought fried foods or pastries, as well as being careful with ice cream or cheeses. At the same time, we need to eat more of the good fats, that is poly or monounsaturated fats that come from fish, nuts, and avocados. And when it comes to oils, using olive oil or avocado oil is the best option. The good news is that cutting out carbs is not a requirement for fatty liver reversal. And it is the quality and the type of carbs that we consume that plays a larger role in the treatment of fatty liver. Eating carbs that have a low glycemic index, meaning they do not cause wild swings in your blood sugar, are much better for your liver health than carbs that are high in the glycemic index. So, while lowering your carbs is generally a good idea for most people, I would not worry as much about consuming lower glycemic index carbs that come from legumes, veggies, or fruits. And I would stay away from high glycemic index carbs like white bread, white rice, most breakfast cereals, and processed potatoes like French fries or chips. Alright, so other things that are highly beneficial in reversing fatty liver disease is abstaining from alcohol. In addition to that, getting at least 150 minutes of moderate intensive activity per week, and making sure to include resistance training or muscle building exercises at least 2 days a week would also help you restore your liver to good health. If you do all of the things I mentioned in the video, you will see changes in your liver biomarkers in a matter of weeks, as seen in the studies we discussed earlier, and you will eventually fully reverse your fatty liver. It is important to do those as soon as possible before your liver turns into a more severe form of fatty liver like NASH, and eventually to fibrosis and even cirrhosis, at which point a liver transplant is our only option. Oh yes, by the way, now to be clear, you do not need any supplements to fix your fatty liver as long as you eat the right things and you use real whole foods as your medicine. I hope this video was helpful, and I will see you in the next one.